What about your cultures?
So, I'd like to ask Professor Kakar to come back to the stage, really, because as a member of the World Thrombosis Day Steering Committee, we actually looked at all the literature, as well as Dr. Cohen's work, looking around the world at the death rate due to venous thromboembolism. And I think we were quite surprised to find that the WHO, the World Health Organization, doesn't actually register deaths due to venous thromboembolism. And so we would like to ask the WHO to register and to log deaths due to venous thromboembolism. Such an august body really ought to be aware and publishing the rates of death due to venous thromboembolism. Would you like to take over?
Well, I will. Thank you very much indeed. So I think what has been most interesting for me about the International Society of Thrombosis and Hemostasis taking the global lead and promoting the concept of a World Thrombosis Day is exactly because it's provided us the opportunity to understand what perceptions are about the overall problem of thrombosis, to help us understand where those responsible for healthcare systems, we as clinicians, our patients and communities, have a reasonably good understanding, and where that understanding is less well secure. And it's quite striking. If you look at the three commonest causes of cardiovascular death, coronary artery disease, stroke, and then venous thromboembolism, very accurate data are generated both on a country level and a supra-regional level by the World Health Organization in compiling their global burden of disease, morbidity and mortality statistics for the first two, coronary artery disease and stroke. But what struck us on the steering committee is the same is not done for venous thromboembolism. And you'll see that there is a publication that has been made by the steering committee of a very rigorous literature review that has tried to help us understand where, in the context of over a cardiovascular disease burden, VTE sits. And it's quite striking because there is an awful lot published. Of course, some of the papers are less good than others. There's more information in certain parts of the world and less in other parts of the world. But as we saw in Dr. Cohen's presentation, there is a consistency that tells us that actually, if you look at both new events and recurrent events, venous thromboembolism is a major problem. And so one of the principal objectives of the World Thrombosis Day today is to say, okay, when we look at all of this, it's an important problem. It may only be number 3 in the overall ranking of causes of cardiovascular death, but it's a really important cause. And we neglect it because we don't describe it. And the first thing we need to do, therefore, is to have an authoritative source collect the data globally and help us all understand how big the burden totally of cardiovascular disease is, because we underplay it, and what venous thromboembolism is. And it's a very, very simple question, because the International Classification of Disease allows us to identify the categories in which death from pulmonary embolism, venous thromboembolism, PE itself will fall. And those data should be collected in the way they are for other important diseases. And I hope that World Thrombosis Day, now happening throughout the world at this moment, of course, allowing for time zones and so on, probably later in the United States, will help achieve that one simple conclusion, that we collect data on venous thromboembolism in the way that we do for heart attacks and strokes.
Thank you very much.